Hi everyone. Today I will introduce my paper. The title is Spatial Variations and the Influencing Factors of Cumulative Health Deficit Index of Elderly in China. I come from Tokyo University of Agriculture and Technology. Research background. With the acceleration of aging and urbanization, it has become a hot topic to make cities more age friendly. The WHO's work on age friendly cities has identified key factors affecting the elderly's health. The outline of the Healthy China 2030 plan mentioned that a healthy city is an important part. China has a characteristics of unbalanced regional economic development, diverse geographic environment, and wide distribution of elderly population. Thus, it is essential to analyze the geographical distribution of the elderly's health conditions. And in this paper, spatial differentiation characteristics and driving factors of the health status in combination with individual factors and regional factors. Elderly health status commonly are ADL, IADL, MMSE scale, frailty index, and cumulative health deficit index (CHDI) to measure physical health, mental health, and frailty conditions and overall health status respectively. The HDI is derived from FI by combining both subjective and objective indicators. FI is an evolving concept that can be divided into two functions, phenotypes and cumulative frailty index. Many studies has shown the CHDI has good predictive power in reflecting health status and health service use, public health management, and so on. 63 variables of CHDI with multiple dimensions, mental and physical, were selected in this paper, which enriched in the diversity of indicators and supplemented the comprehensive indicators in the field of empirical research on CHDI. Research methods. In this research, we selected the data from Renmin University of China, the China Longitudinal Aging Social Survey class is a large-scale national continuous social survey project since 2014 and followed by every 2 years. The survey items include health status, care needs, economic conditions, and social insurance, employment, family pension resources, community pension facilities, community service, and pension planning, pension mode choice, and attitude of elderly towards aging. The survey uses stratified multi-stage probability sampling, which has universality and authority. The data from 28 provinces that present 95% of Chinese mainland population aged 60 years and above, in total 11,418 samples. And this research selected class data in 2018. This figure is the research process. China Longitude Aging Social Survey 2018 used 63 variables, mental and physical factors. used entropy-topsis method to know the CHDI counting quotients. Spatial distribution GIS used to analyze average CHDI and 5-level CHDI among 28 regions. Geodetector, this method used to analyze the factor detection and the interaction detector, and to reveal individual factors, regional factors, and independent interaction or the strength and direction, linearity or non-linearity of the interaction factors. Entropy-topsis method quantifies the importance of each indicator by calculating the entropy value of each indicator, which is innovative and scientific in the construction of indicators. The spatial distribution of the average CHDI and the 5-level CHDI through GIS method that visually evaluated the variation in the average health level among regions and the discrepancy in the graded health level within regions. Geodetector is a new statistical method to detect spatial variation and reveal the driving factors. This method can detect numerical data or qualitative data. It can not only detect whether or two factors interact with the dependent variables, but also can analyze the strength, direction, linearity, or non-linearity of the interaction. It can comprehensively grasp the independent role or interaction of individual factors and regional factors affecting the health status. The entropy-topsis method was used to establish the CHDI to distinguish the weight of each influential factors. And this method compares the relative distance of each measured object with the maximum value and the minimum value. And this is detailed process and formula. So if you are interested in this, how to say, it's very, you can read our paper to know the specific formula and the process. Geodetector includes risk detection, factor detection, ecological detection, and interactive detection. This research was analyzed by factor detection and interactive detection. And a first one is used to identify what factors cause the risk. And interactive detection is used to determine whether the influencing factors work independently or together. This research summarized variables from pre-various literature to screen for factors in the individual and regional dimensions. The 2 dimensions factor include a total of 23. Individual indicators include age, gender, months, level of education, proportion of only one child, and the regional indicators include GDP, unemployment, urbanization rate, and population density, and so on. Let's see the research results. Descriptive statistics. The mean age of these samples was 71.45 years, and the ratio of males and females was 50.9 49.2% and 49.9% respectively. The rural population accounted for 42.3%. The proportion of having a spouse was 69.3%. The overall 9,389 valid samples had a low education level, with 26.5% being illiterate and 67.2% being below primary school. The weight of mental health indicators is 3 times that of physical health indicators, and its composition formula as below. Individual CHDI was more associated with age and was more evident in females than males in the figure 2. Spatial distribution pattern and characteristics analyzed. Left figure is average value of CHDI. This research counted the average CHDI and 5-level CHDI in 28 regions in China and visualized in the maps. CHDI average values shows the distribution trend of whole line. The red line in the figure, in the left figure. What is the whole line? Whole line is Chinese Hu Huan Yong line. It is a well-known natural geographic dividing line. It bisects China into 2 regions. The east of Hu line, EHL, and the west of Hu line, WHL. EHL is 36% of the territory and is occupied by 96% of the population. WHL is 64% and 4% respectively. The whole line reveals the spatial distribution pattern of population density, and the dividing line for both environment and human activities in China was unchanged since the 1230s. So in the left figure, we can see the geographic information graph. The HDI in WHL regions are lower than in the EHL regions. Let's see the table 3 average CHDI values of 28 regions. The lowest 3 regions were Inner Mongolia, Hunan, Anhui, which indicated that the health status was relatively good. The highest 3 regions are Heilongjiang, Fujian, and Hubei, indicating relatively poor health conditions. This is a 5-level CHDI. The geographic distribution maps of the 5 levels CHDI reveal that the CHDI classification level of the elderly in the same region is very different. This is the geodetector analyze results factor detection. In the table, left table, the factor detector results indicate that the larger the Q value of the factor, the greater the explanatory force of the factor for spatial separation. From the data results, the individual factors that affect CHDI with largest spatial differentiation are personal income, NPT list, and aged 80 and above, while the regional factors are proportion, participating insurance, density, population, and GDP. This is interaction detector figure. The 2 different factors, individual and regional factor, or show 2-factor interaction effect and enhancement or non-linear enhancement. The strongest effect of the interaction on CHDI are personal income and quality of air, personal income and GDP, personal income and urbanization rate. Personal income had the highest Q value among the interaction effects, and all other factors which was associated with a higher unifactorial explanatory force of personal income on CHDI. Personal income has the strongest combined effect with quality of air, GDP, and urbanization rate. Discussion. The core factor is the psychological aspect, which was 3 times than that physical aspect. Depression, loneliness, and cognitive ability accounted for the largest proportion. Self-rated health ADL and IADL accounted for less than 10%, little impact. The CHDI increase linearly with age, and women are consistently higher than men. The average CHDI value appeared in the whole line distribution tendency, and in the WHL are smaller than that in the EHL. Individual indicators such as personal income, emptiness, and aged 8 and above. Two dimensions factors interaction was significant, particular personal income and quality of air, personal income and GDP, and personal income and urbanization rate. Although regional factors have a weaker influence on the elderly health than individual factors, interaction was evident. Nearly 50% of the respondents in the research were in the empty nest, and the decrease in family support poses a great threat to the health of elderly. The results indicated that family factors were a significant influence on the elderly. In the factor detection, empty nest, household income, and in the number of cohabitants are all ranked relatively high. The fourth part, conclusions. CHDI is a subjective and objective comprehensive index, and mental indicators are primary factors. Thus, attaching importance to psychological care of the elderly is the key to building a healthy aging society. The large individual heterogeneity and spatial differentiation of CHDI in the elderly were demonstrated by map visualization. The spatial differentiations is mainly affected by individual economic and social factors, but also by the interaction with regional factors such as quality of air, GDP, urbanization rate, and so on. So it is also plays a guiding role for the country in balancing regional economic development, promoting health and sustainable urban development, and creating age-friendly cities. That's all. Thank you for your listening. Thank you very much.